Go slides. Okay, this is our presentation on Hep B and C. Hepatitis is inflammation of the liver cells, and this is a picture of chronic hepatitis. Like that's how the liver looks. Signs and symptoms of hepatitis are fever, vomiting, dark-colored urine, clay-colored stools, and jaundice.
Hey, this is Kevin. I'm going to talk about the prevalence of hepatitis B and hepatitis C. I did a lot of research and I couldn't find the specific numbers on the Arkansas website. So what I found came from the CDC. For hepatitis B, according to the CDC, between 2016 and 2020, just in Arkansas, there were 49 cases reported in 2016, and there were 36 cases in 2020. So that it shows that there's a decline each year. The majority of those cases were from 30 to 49-year-old age group, predominantly male and predominantly Caucasian, non-Hispanic. The prevalence of hepatitis C, similarly, I had to go to the CDC's website. There were no cases reported in 2016, at least to the federal CDC. But so between 2017 and 2020, Arkansas's cases increased each year, with one case reported in 2017 and 65 cases in 2020. The majority of those cases that were reported were from the age groups of 20 to 39, and again, they were predominantly male and white, non-Hispanic.
Okay. Hello. So I'm going to be talking about the transmission of hepatitis B as well as hepatitis C. So hepatitis B is transmitted from person to person.
Hello. So I'm going to be talking about Hello, so my name is Sharonica, and I am going to be talking about the way hepatitis B as well as hepatitis C is transmitted. And I'm also going to be discussing the diagnostics on which are the ways in determining if there is hepatitis B or hepatitis C within the body. So the hepatitis B is transmitted through blood, semen, and other bodily fluids. It can be exchanged through sexual contact, the sharing of needles, accidental needle pokes, or it could be transmitted from the mother to her newborn child during birth. Hepatitis C is contracted through the sharing of tattoo, like via tattoos, especially if the tattoos are done like in a non-sterile with non-sterile equipment. Sharing toothbrushes and razors. It can also be transmitted through invasive surgery procedures like at healthcare centers. In rare cases, it can be transmitted through sexual contact, but that's very rare for hepatitis C.
Can you get it through toothbrushes for real?
Can we start? Okay, so hepatitis B is diagnosed via blood test. It's also diagnosed through liver biopsies and a liver ultrasound. Hepatitis C is diagnosed through blood tests, enzyme-like immunosorbent assay, which is ELISA, or recombinant immunoblot assay or through reverse transcriptase polymerase chain reaction or through a liver biopsy.
So I'm Alexis. I'm going to talk about the method of treatment for hepatitis B and hepatitis C. So treatment depends on the levels of immunoglobulins found. So that's going to tell us how severe, acute or chronic the infection is. So for acute hepatitis B, treatment may not be necessary. It depends on the provider. So symptoms would be treated with IV fluids, IV nutrition, lifestyle changes such as decreasing alcohol and a healthy diet, and pain management. And you still should get the Hep B vaccination if you are infected because it can help your body build antibodies for hepatitis B, and that can help decrease the hepatitis B infection as well as improve some of the symptoms. So immunoglobulins less than 200,000 have been shown to resolve on their own or they're non-symptomatic. Greater than 200,000 would be when providers start to treat the hepatitis, especially if there's pregnancy. So the healthy diet needs to reduce cholesterol because the liver can start to harden through cirrhosis. Same with alcohol can worsen the condition. So the less fat and grease we introduce to be filtered through, the better the liver can combat the hepatitis B infection. So both HBV and HCV depend on the severity. Ultimately, a liver transplant would likely be needed for HCV and potentially HBV depending on how severe the infection is. So symptomatic treatment, we want to reduce inflammation and prescribe antivirals. Antivirals are going to be a lifelong treatment for those with chronic HBV and HCV. And then depending on the immunoglobulins, we might introduce interferons. These are immune modulators, so they pretty much adjust the way that our immune system fights off infection and assist in introducing antibodies to help combat that. So in pregnancy, it can cross the placenta barrier and transmit to the fetus. So the pregnant person would likely present with preeclampsia, gestational diabetes, or cholestasis. Cholestasis is extreme itching, which is common in pregnancy anyways, but it would be a more extreme version of this. The fetus may present with preterm birth, a low birth weight, congenital abnormalities. They might develop pediatric hepatitis if it is transmitted. Cirrhosis is likely to develop at a younger age, and neonate withdrawal has been found with hepatitis B and C. That's due to hepatitis B and C being contracted through sharing needles. In some cases, that can be sharing needles for IV drug use. So if the mother is an IV drug user, then the neonate will also be withdrawing from those strokes as the delivery progresses. So the same immunoglobulin levels is also looked at for chance of transmission. So over 200,000 would have a greater chance of transmission. And the greater those immunoglobulin levels are, the greater the effects to the fetus are, and that's also associated with a higher risk of NICU admission. So treatment in pregnancy for hepatitis B is the same. You would want to consult the provider. They may or may not want to treat depending on the immunoglobulin level. Antivirals may be offered for symptoms, but depending on the provider you see, there are different antivirals that different providers want to recommend depending on the studies and how they practice. Some are seen harmful to the fetus, some it's risk versus benefit. So it's really ultimately between you and the provider what treatment route you want to use for HBV. Neonates should receive the vaccination series. So you should get the HBV or the hepatitis vaccine at birth or within 12 hours of birth. But then if the mother is positive or HBV is suspected, you want to get the HBIG. This help specifically fight the infection instead of just as a prophylactic method. So they will also monitor AST, ALT on the child at pediatric visits. Depending on the severity, they may contact a nephrologist. And then interferons or antivirals that have been approved for pediatric patients could be used depending on symptoms and the provider that's monitoring. Prophylaxis treatment of hepatitis C is not recommended during pregnancy. It's seen, some providers think it could be toxic to the fetus, so they tend to go more for treating symptoms. It's been found to potentially cause miscarriage or spontaneous abortion or congenital abnormalities after birth. So you wouldn't want to prophylactically treat, but once the birth has occurred, you still want to go through with the vaccination series and a similar treatment as HBV. So if symptoms are severe, the provider may want to treat with antivirals. If they're not so severe, they may say to monitor and see how it goes and still get the vaccination series. But ultimately, the best way to treat HBV and HCV is to prevent it. So early detection and early vaccinations would be the best option.
Ready?
Okay.
All right, there's a test. You didn't know, but you gotta pass it, or you don't get to go on a TRN3. So we're gonna go over a little bit of each slide. What does chronic hepatitis lead to? Anybody know?
Cirrhosis.
That's right. And can anyone remember how many cases of hepatitis C were reported in Arkansas in 2020?
65.
All right. And how is hepatitis transmitted?
Through blood, semen, and IV, and drug use.
IV drug use. That's
IV
right.
drug. Mhm.
Anyone know some ways that they can diagnose hepatitis?
Blood, liver biopsy,
Liver ultrasound?
liver ultrasound, the
And-
ELISA, the RIBA, and the PCR.
And some treatments are IV fluids, IV nutrition,
Lifestyle changes.
and of course, pain management. Thank you all for listening to us.
Hope you didn't feel that.
I'm sorry.
Nope,
What's happening?
I don't know.
Okay, I got it.